Welcome to UOA On Demand. It's a pleasure to be here with you. My name is Patrick Buckley. I'm a sports medicine surgeon here at University Orthopaedics, and it's my pleasure to have Dr. Justin Fleming, who's a foot and ankle surgeon, here with us at UOA to talk tonight about total ankle replacement. So Justin, welcome. How are you?
I'm doing great, Patrick. How about you?
I'm doing great. So look, this is a really interesting topic, and I know this is something that you're really passionate about. And I think that for many patients, they're very familiar with a hip replacement, a knee replacement, but I think a lot of the times patients may be a little surprised you kind of can replace an ankle. So I'm curious how you explain that to them and kind of how you compare this to hip and knee replacements and how you kind of translate that into helping patients who have ankle arthritis and ankle pain.
Sure. Yeah, I think that's a great question because, as you mentioned, hip and knee replacement is just so common, especially in our practice and with the aging population in the country. And it is, I think, largely a surprise. A lot of the patients that I encounter say exactly that. Boy, I didn't really know you could replace an ankle. And I guess what I would tell them that it is an emerging technology. Even though the initial ankle replacements were done in the 70s, we're on our third and fourth generation implant at this point. And we're just fortunate enough to live in a time where we have technology and that we understand the ankle a little bit better. And I guess one thing that I tell them is that hip and knee arthritis is really wear and tear arthritis, as you well know. And it's almost the complete opposite in the ankle. So hip and knee, even though these patients experience the same amount of pain as those patients with the ankle, hip and knee happens later in life in their kind of later years because the joints just kind of wear out. Ankle arthritis is predominantly from an injury. So someone who has an ankle fracture, an ankle sprain, et cetera. And the problem is that these patients develop arthritis in their 30s and their 40s and their 50s. And so that puts us in a situation where, you're left with these two options, whether to do an ankle fusion or an ankle replacement. And that kind of generates the discussion of, when and who can have an ankle replacement.
Yeah, I mean, that's probably an interesting thing to mention or talk about there. It seems like those are really your two big options when you have someone with ankle arthritis. But can you maybe go through the pros and cons of, ankle fusion versus replacement and who specifically you're kind of steering into and recommending an ankle replacement?
Yeah, of course. So, I think we have to look at two things anytime we operate. One is pain relief and one is mobility or function. And so I think that both procedures are very good at pain relief. We know that ankle fusion provides good pain relief, and we know there's a cost to that, and we'll talk about that as well. But ankle replacement gives us the mobility or the functional portion back. And so even though both relieve pain, the ability to continue to move the joint really is significant for patients who, it helps them to walk better, helps them to still enjoy sports and different activities because the ankle is not locked up. And so in terms of, who gets what procedure, basically we don't replace ankles in patients under the age of 50. That's kind of a general rule that we largely follow. And so if you're under the age of 50 with ankle arthritis, unfortunately, fusion is really the only option. Patients who are laborers, if you are a mason or you work on construction sites, ankle replacement may not be best for you simply because there's a lot of wear and tear on the device. And we think it would have a shorter life and need replacement later. So the people that really, I think, fit the category or who I would encourage to think about ankle replacement are patients 50 or older, patients who have an active lifestyle. You're not going to be able to play ankle or play basketball with your ankle replacement, but certainly you can play pickleball and golf and tennis and those types of things. We generally like people that their ankle moves already. If you have good motion in your ankle or some motion in your ankle, that's really helpful when we do the replacement because we think we can maintain or perhaps increase the ankle motion that exists. If you're a smoker or you have certain types of diabetes, really neither procedure is going to be good for you. Those are things that are general negatives. But we're looking for someone who has a BMI of 40 or less. That's kind of the cutoff for knee arthroplasty. We don't really have a direct cutoff for the ankle, but we kind of use hip and knee as a guideline.
Sure. Yeah, I think that's a great outline. And, I know that many patients really have questions about both what is it like for surgery as well as what they can expect after surgery. So, maybe why don't you go through what it's like for them? Do you do this in a hospital, in a surgery center, and then kind of walk through the kind of initial recovery for them with weight bearing and then physical therapy, and then when they kind of get back to those activities that you talked about?
Sure. So typically the surgery is done in the hospital. Often it could be done same day. And it really depends on the patient. So often patients that have ankle arthritis also have some deformity in their ankle, meaning that the ankle is tilted either to the inside or to the outside, or perhaps they have, foot deformity as well. Perhaps they have tight tendons or loose ligaments or things that have added or contributed to the arthritis. So the amount of surgery really depends on the patient themselves. So, we're grateful when a patient has very straightforward ankle arthritis with no deformity. That procedure is 90 minutes long. Patients go home the same day. And then we have patients that come in where the ankle's tilted 45 degrees, and there's the complexity of fixing the foot, making the foundation for the ankle, and then doing the ankle replacement as well. Those patients typically have a slower recovery. They may spend another day in the hospital because there's a greater volume of surgery. So it is a general anesthetic. The majority of anesthesiologists that we work with will numb up the leg, and the benefit of that is that you get less anesthesia, you feel better afterwards, it's safer, and then you're taking less pain medicine for the next couple of days, that critical time period where people are struggling from a pain standpoint. So I think it makes the surgery a lot more comfortable. And then in terms of weight bearing, somewhere between 4 and 6 weeks, that's the time that the patients are not putting weight on their foot. And for the reasons I just mentioned, if we're doing a little bit more work, those patients are relegated to 6 weeks because we need the bones to heal the appropriate alignment. And it takes about 4 weeks for the implants to kind of create a seal with the bone and get stable. So based on the amount of surgery that you have, that determines when we start to walk. But generally by week 6, patients are in a boot doing range of motion, physical therapy, starting to walk again. And then somewhere between 8 and 10 weeks, the majority of patients can get back into a sneaker, which is a relatively surprisingly quick recovery for a large volume of work.
Yeah, for sure. And I feel like in many ways the pain relief, when you take out the arthritic ankle and replace it, you have that pain relief right away, and then you're dealing with post-surgical pain. And certainly I see the same thing, that the regional anesthesia, is a big part of that, where you can have a nerve block and get through the initial part of the recovery. And for the most part, the pain is relatively minimal and well controlled. But I'm not sure how you feel about that for an ankle replacement.
Yeah, I think it's great. If it was my family member, that's certainly something I would want. The anesthesiologist, from their standpoint, they have to give you less medicine to keep you comfortable. So, you get sick less, you feel less sedated afterwards. Your body is able to recover from surgery a lot quicker. And then from a patient standpoint, your comfort level increases significantly. The amount of pain medicine that you have to take is markedly reduced. We all understand the importance and the danger of narcotics and opioids. And so it's really beneficial for a lot of patients.
Yeah, for sure. I feel like one of the unique things with someone who does a lot of ankle replacements like yourself is that you really specialize in that. I guess I want to see what your thoughts are and for patients when they're looking for a surgeon, and how you feel that volume of surgery as well as experience of doing it really adds into their outcome and the result that they get from that.
Yeah, I think that's a great point and a great question. And so I initially trained on total ankle in 2009. And I just really didn't love the technology. I just didn't think we were, far enough along. And so I really didn't put the first implant in until 2013. So we've been doing this for about 10 years. I do think there's a learning curve, just like anything else. And so I think the higher volume surgeons, if you're doing it on a more regular basis, are able to navigate difficult cases, problems, complications. And so I think the learning curve is probably around 40 or 50 total joints. And then after that, I think we're in a little bit of a comfort zone. I also think that, and the literature would support this, that every time you switch to a different system, meaning I use a different type of implant, the learning curve starts over. And so the company that I like to use is called Wright Medical. I'm not a consultant. I don't receive anything, but the reason I choose this product is simply because they have implants on a continuum. So they have implants for patients that have simple ankle arthritis, implants for patients who have complex arthritis, and then revision implants. And so no matter what we see or what we come across, this company gives us the ability to do that. The second thing that I think increases our experience and our accuracy is patient-specific instrumentation. And so when I see a patient that needs a replacement, the first thing they need to do is get a CAT scan. And the CAT scan is done from the knee down. So that gives us spatial relationship on how the knee and the ankle connect and are aligned together, because that's important when we walk. And essentially that CAT scan is sent to the company, and there's 3 engineers, and that's all they do, is they do the surgery virtually. So they can tell me the appropriate size, the appropriate placement of the implant, and if there's any issues with the bone around the implant. So we get a really significant advantage that we'd be able to walk through the surgery initially, troubleshoot it, and then at the end of that process, I get a report. And if I agree with the report, then the company produces instrument guides that are used at the time of surgery. And so they are specific and based on the 3D models of the CAT scan. And that allows us to get the implant placed accurately, which is important for the implant to survive over a long period of time. And it decreases our time because, it's, again, this is built around the patient's anatomy. So we have that kind of advantage of looking ahead to get through the surgery.
Yeah, I think that's amazing. I mean, the preoperative planning that goes in, and I think this is probably something you've seen that's evolved from, maybe 20 years ago, 10 years ago to today, is there's so much, you can do now with your imaging and planning preoperatively that, reduces time in the OR, and certainly all those things translate into less infection, less risk of pain, less swelling, and those are obviously all really important things for the patient. I'm curious what, like, practically when you translate that, like, has that been pretty accurate? Like, you've seen that's, impressive when you get in there that, hey, the planning was right and I agree with this, or what's that like as you translate into the operating room?
The only time that I've seen it not work is for patients that have complex malunions or bones that are fractured or crooked above. Sometimes that can be a little bit more tricky, but for the most part, I would say 95, 98% of the time, it's incredibly accurate, surprisingly accurate, to be honest. Because sometimes I have patients that I'm replacing their ankle and they've already had a knee and a hip replacement. And so alignment is critical for these patients to be able to walk. We sometimes get so focused on the ankle and we forget about what's above it. But it is important to get the ankle implant aligned correctly with the knee. And that's really what the system allows us to do.
Yeah, really neat. Now, what is what's the ankle replacement made of? I feel like this is a question kind of patients always, wonder, and kind of how is that, metallic component, married with the kind of new joint or the plastic part of this the joint? Like, how would you explain that to patients?
Yeah. So what I tell them, it's basically a plastic sandwich. There's metal on the top, metal on the bottom, and there's plastic in between. And this is very similar to hip and knee designs. The shapes are different, obviously, but the components are made of cobalt chrome, which is consistent with what's in hip and knee replacements. And then we have the plastic portion is this kind of high molecular weight polyethylene, and we refer to it as a poly. And the way that they process it, and they're infusing vitamin E to it, and there's this kind of continual technology to make this piece better, because this is really the cushioning in the joint, right? This is what really ultimately takes a lot of wear. And so, if we can make a better cushion or a better tire, so to speak, for our car, the longer life we get out of it.
And how long are you kind of quoting someone? So, you do an ankle replacement, somebody maybe is in their late 50s or 60s. How long right now would you quote them kind of that joint lasting?
So we think it's about 10 to 12 years. And, the data that we have now is based on a prior generation implant. And so, very well that the things that you're doing now, the research isn't always available. The research is slightly behind what we're actually doing. And so there's actually a study out recently that shows that ankle implants can, in some circumstances, last longer than hip and knee. And I think those results will need to be seen, but we're certainly getting better at it. But to answer your question, I think that 10 to 12 years is a general ballpark range. We know that if you make it to year 2 without complications, the success rate is markedly higher after that. Complications early in the process potentially shorten the life of the implant. And that's the same no matter what is being replaced.
Sure. Yeah, I mean, I think it's really interesting to look at advances in orthopedics over time and how the field kind of grows and evolves. But it certainly seems like a really exciting time to be an ankle replacement surgeon and help patients in that way, because, as you obviously are well aware of, ankle arthritis is a very debilitating thing. So, I mean, what do you usually hear from patients who have ankle arthritis? What sort of, story do you usually have from them? I know you mentioned the trauma part of it, but what are their symptoms that usually you will listen for and hear from them? And then what do they expect to do as they get, past the initial part of the recovery and into the, their life with an ankle replacement?
Sure. So the typical person I see is generally 55 and older. And these patients have had relatively limiting, debilitating ankle pain for a long time, and they've just kind of put up with it. And typically the males have worked through their pain, and they've had braces, and they take Motrin every day, and they've had cortisone injections and stem cells and PRP and this variety of things, and they get better for a period of time, and then the pain returns. And over time, those treatments become less efficacious and the pain becomes significant. Then they start walking differently. And oftentimes it's their wife just not wanting to, entertain the pain anymore that kind of gets them through the door. And so, a lot of patients have also, they come for another opinion. They say, well, I want to know about ankle replacement. My doctor said, I can only have an ankle fusion. Tell me about that. So they present in a variety, but most of the time it's pain, it's interruption of quality of life, activities, time with family, golf. Those are the things I think that drive people primarily into the office. So overall, after doing this for 10 years, I would say this is the most satisfying procedure that I do. I mean, it is an absolute privilege to change someone's life in 90 minutes. I mean, the satisfaction levels are great. I can only smile when I see these patients kind of walk out in sneakers, walking by themselves without a cane, just really happy. So it's incredibly gratifying, and people get relatively high pain relief early. The things that tend to hold people back are swelling, and oftentimes they've been walking in such a way to compensate for their ankle that we have to kind of unteach them that habit. So they walk with their leg pushed out to the side. And oftentimes, the physical therapist has to kind of get their hip joint loosened up and some other muscles firing to get them to walk well again. I think that's probably what is the largest part of physical therapy afterwards.
Yeah, that was actually going to be my next question, is kind of what is PT like after this? And, I know certainly their Achilles and working on range of motion and working on stretching for that. And then, as you mentioned, hip and knee is a big part of it. But, what's that experience usually like with therapists, or excuse me, with working with physical therapy? And you said usually would start around 6 weeks, or when do you get them into their PT visit?
Yeah, so it depends on how much we do. So if it's a fusion plus doing a lot of things to the foot, then I generally don't start range of motion before 6 weeks. If you have a more simpler replacement, at 2 weeks, you get your stitches out, you go into a boot, and you start therapy at 2 weeks. Physical therapy, depending on how long you've been debilitated and what other problems you have, lasts from anywhere from 4 to 8 weeks. Oftentimes, patients have secondary weaknesses or ways that they've compensated, as I talked about before, that they have to kind of unlearn. But typically, it's very gratifying. Patients are getting their function back. They're seeing their ankle move, and they're not, wincing in pain in their first couple of steps in the morning, and they're not, soaking their foot in ice at night. So it's just, I think it's a gratifying process. It certainly is for me, and I believe it's for the patients as well.
Yeah, I mean, well, look, I've seen your patients walk out of here and in the office, and it's a pretty impressive thing to see and to watch. And I know that I think this is something that you obviously are really world renowned in and an expert in, and it's been a pleasure to talk to you about this. And look, I think that if patients have ankle arthritis, or they've been recommended a surgery and they're looking for options, certainly I think coming to meet with you and to talk about this, would be a great idea for them. Hopefully the video and this on-demand presentation has been really educational for them. So look, Justin, it was a pleasure to talk to you tonight, and certainly it's a really interesting topic and a very exciting time to be an ankle replacement surgeon and to really help patients in this way. So, I really open it up to you to kind of have any closing comments here for the patients that are watching this.
All right, well, thanks for your attention. If you're suffering with ankle arthritis and considering ankle replacement, we certainly would love to see you. We feel like we have the experience to care for you well, and you don't have to live with that debilitating pain.